Our next track is titled Research Updates. Please welcome Dr. Matthew Goodwin, Professor of Biomedical Informatics, Harvard Medical School. Dr. Goodwin's presentation is titled Biosensor Prediction of Aggression in Youth with Autism.
Hello, my name is Matthew Goodwin from the Computational Behavioral Science Lab at Northeastern University, giving a lightning talk on biosensor prediction of aggression in youth with autism. This work is carried out with colleagues at the Northeastern University, University of Pittsburgh, and the Maine Medical Center. So some clinical background, why aggression and why autism. Aggressive behavior can isolate youth with autism from foundational, educational, social, and familial activities. As many as 2/3 of youth with autism display aggression, which is one of the primary reasons they use behavioral healthcare services. Aggression can present imminent safety risks for the individual and others in the environment, and families report that aggression increases their stress, isolation, and financial burden, and decreases available support options for their children. Aggression is particularly impairing and treatment refractory in the 30 to 40% of youth with autism who are minimally verbal. Their inability to self-report distress can lead to behaviors that seem to occur without warning, sometimes long after any observable trigger. Here's a testimony from a mother of a young man with autism, Ryan, wherein she says, "Due to his inability to manage his emotions and communicate, he attacks us when he becomes agitated or stressed. This behavior is very unpredictable and often occurs with little to no warning signs. It has happened in our home, his school, in the community, and sometimes while driving a car. It is so bad that we can no longer safely live in our home with Ryan." The hypothesis and objective of the present study is that physiological arousal precedes aggressive behavior. Our objective is to test whether proximal onset of aggression can be predicted from preceding physiological signals using wearable biosensors and machine learning algorithms. The participants in this study include 20 ADOS2 confirmed, behaviorally unstable, minimally verbal youth with autism in the Developmental Disorders Unit at Spring Harbor Hospital in Portland, Maine. The sample on average was 11 years old, 75% male, 95% Caucasian, 90% non-Hispanic, with a mean nonverbal IQ of 66, wherein 65% met criteria for an intellectual disability and showed clinically significant scores on the caregiver-rated aberrant behavior checklist irritability subscale. We employed the E4 biosensor by Empatica. This is a shockproof and waterproof sensor that is worn on the wrist and wirelessly records heart rate and heart rate variability derived from blood volume pulse and interbeat interval data via photoplasmography. It records electrodermal activity, which is a measure of emotion-related sweat and movement acceleration or physical activity using a 3-axis accelerometer. So collectively, the sensor enables you to record cardiovascular, electrodermal, and physical activity in an untethered way. Over the course of data collection for these 20 participants while wearing the E4, we conducted 69 data collection sessions totaling 87 hours, wherein we observed 548 total aggressions, with a mean and standard deviation of aggression frequency of 27 on average per session that lasted on average 32 seconds per episode. Using support vector machines and time series data from the E4 biosensor, in these 20 individuals, we were able to predict aggression 3 minutes into the future using 1 minute of previous data with 98% accuracy. Currently, we are continuing this work to assess the generalizability of our results in a larger independent sample of youth with autism. This includes 80 participants worth of data collected thus far from 3 separate clinical inpatient sites. We're also developing a non-homogeneous Poisson process model capable of providing a probabilistic measure of aggression onset at longer future time intervals. And we're working on discriminating aggression to others versus self-injurious behavior versus perceived emotion dysregulation without aggression, what we might call a multi-class prediction evaluation. We are also underway developing assistive technology prototypes to see if we can push real-time aggression risk predictions via Wi-Fi or Bluetooth to a mobile phone, where we can display a risk alert on the mobile application when indicated. This would enable caregivers to monitor these alerts and initiate de-escalation or emotion regulation interventions before aggression occurs, wherein we can assess the efficacy of these alerts, facilitating de-escalation and/or emotion regulation interventions through a randomized clinical controlled trial. We've published 5 papers to date on this work. I provide the references here for those who are interested in reading more. I'd like to thank the families and participants, individuals at Northeastern University who supported this work, and individuals at the Maine Medical Center Research Institute who supported this work, and acknowledge our funding agencies, the Simons Foundation, the Nancy Lurie Marks Family Foundation, the National Institute on Deafness and Other Communication Disorders, and the National Science Foundation. I'd also like to share results from a recent survey from the Simons Foundation SPARK initiative that was directed at 70,000 families who have agreed to be reconsented for research, asking about the impact of COVID-19 on families and children with autism. And for where I think the technologies that we are developing and the results that we are generating have particular salience during this time. So this survey was administered to 70,000 families, 8,000 completed it, and they are reporting on the period of March 20th to March 30th, 2020. Some of the key findings, again, I think relevant to the need for more work in remote monitoring and support in this population, come from 93% females, 80% of who have a male child, relatively good capture throughout the country geographically. These 8,000 families, 98% report that their school was closed based on COVID, and that only 35% of them are receiving remote services or therapies. Of the large percentage of the families who are reporting disruption to their services are reporting overwhelmingly that this is happening in the school setting and the professional clinic setting. And perhaps most importantly, 90% of these families report feeling stressed or overwhelmed due to disruptions in their services. 95% of families report that COVID-19 has negatively impacted their mental health. And if we couple this with the data on the right, that 95% of those families are reporting that disruptions in services have negatively impacted their child with ASD's behavior. So they're reporting more aggression, more self-injury, more elopement, more property destruction as a result of lack of services during COVID. And 82% of families are reporting that COVID-19 has negatively impacted their child with ASD's mental and emotional health, including anxiety, depression, and obsessive compulsive disorder. And so I think that survey results like this are showing us how acute disruptions in services can be for individuals with autism. And I hope that some of the work that I have presented in the biosensor prediction may be a means for us to accelerate the development and testing and see if we can't help create more assistive technologies that caregivers can use in their own naturalistic settings when not having easy access to professionals to help predict and better manage some of the behavioral challenges of their children. Thank you.